everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about Cryptorchidism. Now, first, let us understand the meaning of Cryptorchidism. So, the word Cryptorchidism has derived from a Greek word, which is crypto, which means hidden. And then we get also one more term here, if we divide this word, that is orchid, which means testicles. So we can say that the word Cryptorchidism means hidden testicles, right? Yes, so it is the most common birth defect of male genitalia. However, if we see the treatment or how it gets corrected, we can say that we can see that 80% of the cases, or most of the cases, gets corrected by the first year of their life. So from the meaning of this word Cryptorchidism, we understood that there are hidden testicles, right? So that means the testicles are present, but it is not present at a location where it is supposed to be, right? So it is hidden somewhere, or it is located in a place where it is not supposed to be, right? So let us move to the definition of Cryptorchidism to understand this condition in a better way. So Cryptorchidism is the failure of one or both testes to reach the normal position in the scrotal sac through the inguinal canal. So that means there will be absence of one or both the testes from the scrotum, right? Again, in the definition, we can also see that, it is saying that the testicles would fail to reach the normal position, right, from the inguinal canal to the scrotum. So that also means that it does not descend, right? The testis doesn't descend down. And that is why in simpler term, we call it as undescended testis. So you can remember that Cryptorchidism means undescended testes. That means the testicles don't, descend down to the scrotum. Now let us move to the types of Cryptorchidism. So when we are saying that it is a process of descending down from the inguinal, from the abdominal cavity through the inguinal canal, to the scrotum, right? So it is a process of descending down, right? And that means this process can stop anywhere. So we can see this, the testicles can be presented at any location, right? So that is why based on the location where it is present, it has different types. So there are different types of Cryptorchidism. Now the first one is canicular testis. Now in canicular testis, so what we can see is that the testicles would be present above the, above the normal position or usual position where it is supposed to be in the scrotum, but it is still outside the abdominal cavity. That means it has started descending down from the abdominal cavity, but it could not reach the scrotum. So that is what is canicular testis. The next one is intra-abdominal testis. Now from the name itself, you can understand that intra-abdominal, that means the testis would be located inside the abdominal cavity. And then we have ectopic testicles. So ectopic testicles are something where, the testicles are located in the region. It is not located in the usual pathway. So it has a pathway, right? When it comes down from the abdominal cavity to the scrotum, it has an usual pathway. But in ectopic testis, what we can see is that this will not be in the usual pathway, but instead it will be located in the region. Now again, we have different types of ectopic testicles, because if it is not in the usual pathway, when we are saying it is in the region, again it can be located in different region, right? So again, we have different types of ectopic testicles. The first one that we have here is prepenile. So here we have a picture where all the types of ectopic testicles are pointed here. So you can see the first one is prepenile, which is located above the scrotum, and it is located in the middle. Then we have superficial ectopic testicles. So here in the picture you can see that the superficial ectopic testicles are found at the edge, and it is above the scrotal sac. And then we have transverse scrotal. So this is again located at the suprascrotal position, And then after that we have femoral. So in femoral, you can see that the testis would be present in the thigh. So these are some of the examples of ectopic testicles. Now you can see in the picture that this can be located anywhere in the region, and it is not present in the usual pathway. Now, apart from these things, there is also something called as absent testicles. And absent testicles means there is no testicles at all. So that means the testicles haven't formed. Now, this can be bilateral, and wherever if the mother is having uterotorsion, or if there is any vascular insult, or if there is agenesis, that means if there is failure of development of any organ during the embryonic growth. So that is what is called as agenesis. So if these things are there, due to these things, there might be absent testicles. That means the testicles might have not been formed during the embryonic growth. So by now we understood that cryptorchidism means it can be that the testicles are there, but it is hidden. It is not in its usual position. That means it has not descended down to the scrotum. And also it can be found in any other location other than its usual pathway. Now moving on to the risk factors. So what are the risk factors that might contribute to development of cryptorchidism? Well, the first one is low birth weight, and then again if there is premature birth, in that case also it might act as a risk factor for the cryptorchidism. Now if there is family history of undescended testis, or there are other problems related to genital development, then again it might be a risk factor for developing cryptorchidism. Also, if there is a condition of the fetus which can restrict growth, such as Down syndrome, then again that will be a risk factor. Now, apart from these things, there are certain maternal factors also, such as alcohol use during the pregnancy, then again cigarette smoking during pregnancy. Or if the mother is obese, or the mother is having diabetes, it can be type 1 diabetes, type 2 diabetes, or gestational diabetes. Now these things are considered as risk factors of cryptorchidism. Now moving on to the etiological factors of cryptorchidism. So the exact cause of cryptorchidism is not known. However, there are certain factors which are considered to be the cause of cryptorchidism. Now, the first one is anatomical obstruction. So, there can be obstruction in the pathway of descent, or there might be failure of rise in the intra-abdominal pressure, and that might cause undescended testis. It might be hereditary, or if there is any chromosomal anomalies, in that case also there might be one or both the testes would be absent. And then short spermatic cord and artery is also believed to be the cause of undescended testis. Now moving on to the clinical features of cryptorchidism. So the most common symptom of cryptorchidism is there will be a non-palpable testis. So while doing your physical examination, you can find out that you would be unable to palpate the testis. Now next, let us discuss about the diagnostic measures. So what are the diagnostic measures that can be used to rule out this condition? Now diagnosis can be done before the delivery, soon after the delivery, and again if the child comes for routine checkup at that time also, this can be ruled out. So the first stage of diagnosis would be physical examination. So while doing physical examination, we can we can see whether the testicles are palpable or it is not palpable, or even if it is palpable, what is the location of the testicles. So through that, firstly, we can understand if there is, if the testicles are present at any abnormal location, or if it is not palpable, right? So if we find out that, the testicles are not present at the proper location, then we can move forward with the other diagnostic measures. So we can do ultrasound or CT scan to find out what is the exact location of the testicles. We can also do diagnostic laparoscopy, hormonal assay, blood test and urine test. And then, as I mentioned earlier, that it can be, diagnosed before the delivery also. So that can be done through prenatal ultrasound. So through prenatal ultrasound, we can find out even before the delivery also that if there is any, any sort of problem like this is present. Now let us move to the management. So first we will talk about medical management, but before talking about medical management, I would like to tell you one thing, that most of the cases of undescended testes gets corrected by the first year of their life. So that means the testes will descend down naturally without treatment. However, if that does not occur, there are pharmacological management. So the child will be given hormonal injection, that is BHCG or testosterone, which would help in help the testis to descend down to the scrotum, and it also helps in enlargement of the testis. So this was about medical management. Now let us move to the surgical management. So surgical management is usually performed at the age of 3 to 6 months. And then in surgical management, orchiopexy is done to bring the testis into the scrotum. So this is the main surgical treatment. Now moving on to the complications of cryptorchidism. So in complications, what happens, for the testis to function properly, it has to be in slightly cooler than the normal body temperature. And the temperature in the scrotum is exactly like that. It is slightly cooler than the normal body temperature. So that means the testis has to be in the scrotum to function properly, right? But in case of cryptorchidism, what is happening? It is not descending down to the scrotum. Instead, it is, it is staying in the abdominal cavity, or it is above the scrotum, where the temperature is quite higher. It's higher than the scrotum, right? And in that temperature, it cannot function properly. So what would happen if the testis is at the abnormal location? If it is not at the in the scrotum for for a long period of time, that temperature is going to affect the testis, and the testis would undergo changes, and that would decide that how it would function later in life. So as a complications, there might be testicular torsion, testicular cancer, and infertility. So this was all about the complications of cryptorchidism. Now let us move to the nurse's role in taking care of a child with cryptorchidism. So the first thing would be adequate rest. So you have to explain the parents that what is the importance of adequate rest, and they should make sure that the child takes adequate rest. And even when the child is in the hospital, it is your responsibility to make sure that the child is taking adequate rest. And then the next thing is about nutritious diet. So you have to explain the parents that they should provide nutritious diet to the child. And even when the child is at the hospital, it is, you have to make sure that you provide nutritious diet to the child, because it is very important for the recovery. Then you also have to explain the parents that the child should avoid sports. He should avoid any rough activities, any rough playing or bike riding. So these are some of the major concerns that you have to take care of when you are taking care of a child with cryptorchidism. So let us conclude our today's topic. Today we discussed about cryptorchidism, which means undescended testis, right? So the testis doesn't descend down from the abdominal cavity through the inguinal canal to the scrotum, right? And because of that, what are the problems the child will have and how it will be corrected, about that we discussed today. So I hope you have got a better insight about the topic. Thank you.